Ready, go.
Okay. Hey guys, we're coming to you all chill and relax, laying back on the couch to talk to you about total knee replacement. Don't leave. We haven't changed format. We just want to catch you all up on what's been going on with Cindy and her knee replacement thus far. We're going to have a little bit of RV content hint maybe there, but we know there are a lot of you who have been following what's going on, maybe a little bit curious because we do get the questions, and give you it's going to be knee replacement surgery today.
Not knee replacement surgery recovery
updates.
Yeah,
we don't have to go through it,
and it's going to be the honest update. The honest what am I looking
behind the scenes. You will get what it's like to be going through this, which you will also find out you're not going to find anywhere else. Let's get to it.
Are we recording? We are recording, right?
We are recording.
Just checking, because we may or may not have sat here for an hour doing this video and then realized the camera wasn't recording.
Well,
but that's okay. I got all the emotions out and everything. So we're just gonna knock this one out.
This is take two because Dee was trying something new, and we set this up to record and got about 5 minutes of this update. So we're gonna do. We're actually watching it record now. So if we're not looking at you, we're looking at us. Bear with.
We'll try not to look at ourselves.
We don't want to do this again. We know you don't. Anyway, Cindy went through total knee replacement surgery 4 weeks ago. 4 weeks ago Friday. We're going to tell you how we got here, what it's been like to get here, and what is next after we're done here. And that is not just the knee replacement. We may or may not clue you in on what's next with the RV side. Let's go back to the very beginning.
I was born in Fort Wayne, Indiana.
Not that far back. Okay. All right, so you can do it best. Explain to people what led you to have knee replacement surgery.
Years of pain in my knee, which actually was my leg. It was always my leg. There were many times I just figured I must have bone cancer because it's not, my knee doesn't hurt, my whole leg hurts. But for literally years, in the spring of 2023, going up the West Coast, there were so many things I couldn't do because I couldn't walk without a lot of pain. And, you know, nobody likes to inflict pain on themselves. I did do a lot of the sightseeing things. I climbed some lighthouses and I walked through suspension bridges up in trees because I was there and I wanted to do it, and I didn't know when I'd get a chance to do it again, but it was hard.
She did the Astoria Tower with it like this.
164 steps, right? One leg at a time. Step.
I didn't. It had nothing to do with her knee or my knee. We've been married a little over 12 years.
Yeah.
When I met her, she had knee problems.
Mm-hmm. So if you're at all familiar with the Phoenix area, there's, you know, lots of mountains. That's why it's called a valley. It's surrounded by mountains, but there's some mountains in the valley. And one of those mountains is called Camelback Mountain. And Camelback Mountain is very popular to go hiking up to the top of the mountain. I used to hike Camelback Mountain years ago, like pre-D. I hiked Camelback Mountain and I did it with a knee brace and I always said I could go uphill all day long. It was coming down that really, really bothered that knee. And I can't remember when was the first time I had a cortisone shot in it, but it was years ago.
It's been a minute then.
It's been several years. I've had cortisone shots in my knee for years. I had to find a surgeon that would give me a cortisone shot when we were on that spring trip in 2023 up the West Coast, because I was, you know, having so much pain. And that was the first time I realized, things are getting worse, because that shot didn't really help me like the other ones had.
Even then, we talked about, wouldn't this be a great place to come back to and have him do the knee replacement surgery? We knew it was coming even then.
And can you imagine? Yeah, we talked about doing that. Like I could get into the Airstream.
Oh, that would
please. Anyway, so, you know, Dee and I used to walk every morning. Oh, what word did you hear? Did you see his
I
Head snap.
did.
We used to go for
Oh, there
WALKs,
you
just
go.
the two of us, every morning, and I loved that. We'd go for what, a 2 mile?
It is, yeah, about
That was
that.
our thing every
We stayed
morning,
right
and
here.
it just got to the point where once those shots stopped working, I couldn't do that anymore. So he went without me. He's made laps around many RV parks by himself early in the mornings because I couldn't go, and he's walked on beaches by himself because I couldn't go. Um, and he grocery shops by himself while I either stay home or sit out in the truck.
It's unusual me picking dog hair off of you.
Last August, I know, right? Last August, when we got home from the
The Ford trip.
the Ford trip,
That's what we call it now.
the Ford trip with no AC, I went into where the next town over where my daughter lives, about 40 minutes away, and took my little granddaughter to her school open house thing right before school started.
Oh, yeah.
And so I had to be on my feet a lot. I had to drive all the way in there. I had to be on my feet a lot. And I was literally sobbing in tears on the way home. And Dee had to come out to the Jeep and help me in the house because the pain in my leg was so severe.
Yeah.
And, but at this point, it's like I keep getting these shots in my legs. They're not working anymore. And, no doctor will tell me I need to have knee replacement. I don't understand what the deal is. But I finally found out because I finally asked. And he said, "Well, you kind of have to tell us that you want it. It's an elective surgery." My knee is bone on bone. Why is that elective? Why? I mean, I'm not a doctor. A doctor should say, you need to have your knee replaced.
I watch a lot of doctor shows, a lot of emergency room shows. And when you come in and they're like, oh, yeah, your femur's broken, we're going to have to operate. That never happens with your knee replacement. They never say, you're bone on bone. You're not going to get better. We're going to have to operate. Yeah. It's like, well, when you... Jimmy says hi.
But last May, I went to Ireland with my son. That was really hard trip. Whew, boy, that was painful. I'll never forget when I landed in JFK and I had to literally try to run to my next gate to catch the flight to Dublin. Again, there was tears. I mean, it was miserable. But anyway, when I got home from that, I got the series because the cortisone shots were no longer working. So they did the gel where it was a series of 3 shots, and that didn't work. They didn't do anything. They didn't do anything but hurt when they gave me the shots. Those ones hurt for a couple days.
Yeah.
But yeah, so that's when I knew it was time, and I think it was that doctor, that PA, that gave me the shots. When he's the one that said you have to say that you want this done. So anyway, when we were on that summer trip last summer, the Ford trip, I started reaching out to some friends that I knew that had total knee replacement. Looking for a surgeon. I wasn't comfortable with the surgeon I'd been going to get the shots in the neighboring town here. I just wasn't really comfortable, and I'd been doing a ton of research, and I knew I wanted a doctor that did robotic assisted and quadriceps sparing. And so through a bunch of research and talking to people, I found my surgeon down in Scottsdale. And so we went down there, and well, we had the first visit was a televisit, and with his PA, and she assists him in surgery.
We can plug him here, Dr. Copper.
Bertrand Copper.
He's been outstanding.
Kaper, amazing. Yeah. He's really awesome.
He's a good guy.
But anyway, so we met with Emily Foley, his PA that assists him in surgery, and through the televisit. And so we're just talking about my everything that's been going on and everything. And she says, well, so there are some things that we can do. We can do some PT. We can and I stopped her. I said, listen.
She was in tears.
And I started crying. I fell apart, and I said, I want my knee replaced. I need my life back. I have no quality of life. I cannot do any of the things that I want to do, and I need my knee back. She says, okay, we can do that for you.
Those are the magic words, evidently.
You have to tell them. You have to tell them that you want it, Anyway, so started prehab Doctor definitely wanted me to do prehab. A month later, we did go meet with the surgeon. That was such an eye-opening visit for me. First of all, he was awesome. He acted like he had all the time in the world to talk and visit with us and answer any questions, and showed us the prosthesis that goes in there, the part that goes down on the tibia and the part that goes up on the femur. And he said, basically, what we're doing is we're replacing your cartilage. And I said, you're not going to cut my knee off? And
It's knee replacement.
He kind of shook his head and chuckled a little bit. And he said, there's such a misconception. He said, a lot of people do think that we cut the leg off. We don't cut your leg off. They reshape the end of the femur and the end of the tibia to put these pieces on it. And yes, in the tibia, they do have to drill a little hole to put the thing down in there. And so I felt really good about that, but did prehab for what ended up to be 4 months before I finally had the surgery. And then it was surgery day. Well, the day before surgery day, they canceled it.
They did.
Because the humidity was off in the operating room.
So we were in the valley, and here's a little hint that we're dropping.
Here's a teaser.
We were in the valley looking at an RV that we were interested in when we got the word that your surgery is canceled the next day because of humidity. It's Phoenix, Arizona, folks.
The humidity's always off.
Man.
But I did find out, actually, from the guy who we were looking at the RV, his girlfriend is a nurse, and apparently humidity in the operating room has to do with infection.
Yep.
So you don't want the humidity be off. Anyway, so it was rescheduled from the 23rd of January to the 31st of January. So the 31st, we got up at dark 30 and left here at 4 a.m. because arrival time was 6:30 and it's 2.5 hours away. And so we drove down there, and I didn't have my knee cut off. I just had it replaced.
Had
my cartilage replaced, yes. Which is what everybody has done in a knee replacement.
So that was fun. It was interesting. And she had that done. They did give her an epidural, which she'd never had. 4 kids, no
4
epidural.
babies, never had an epidural. I was afraid.
Tough woman. When you see what's coming up, realize this is a tough woman. She was afraid to have the epidural. There's nothing compared to what happened, but they did give her an epidural. She was so drugged up by then, she doesn't remember having it.
I don't remember the epidural.
Kind of fun. They called me in the waiting room. I was going to go do stuff. I got so worried. I just sat in the waiting room and waited. That's what waiting rooms are for. And I did go get some breakfast because I hadn't eaten either. The doctor called me himself when they were done with surgery, and he said this was definitely necessary. He said that was really gone. Which is good. That was good.
You wouldn't want the doctor to go, well, we did it, but she didn't really need it.
She would have been fine without it. So it's an hour and a half surgery to have that done. The staff was great. This part of it was wonderful for me.
I'm glad you had a good time.
Thanks. So got to go back, and she's had surgeries, shoulder, elbow. She's had kids. I mean, appendix. They're taking something out of you. Appendix. And I know that you stated you have never had a surgery where you woke up moaning in pain.
Yeah.
Which you did here. So they cranked up the drugs to mitigate that. They wanted her to be as lucid as possible because you have to do the certain things before you can go. You have to potty on your own, and a couple other things. But within like an hour and a half after surgery, they had her up and walking. Blows my mind that they can do that, and you're walking that quick.
Yeah.
So they got her out of there as soon as possible. We poured her into the Jeep and we headed home. She was like, I have to stop at the casino.
I mean, why not?
Yeah. The casino is about halfway home, at an hour each way roughly. So we stopped there, not to drop some quarters, but to just have her walk around the Jeep in the parking lot.
Per doctor's orders, yeah. With that long of a drive, stop halfway and get out and walk.
Be mobile. So we did that. We got her home and then poured her into bed. The medications they gave you were meloxicam, which reduces the swelling. It's
anti-inflammatory.
Right, anti-inflammatory. Think Advil. Tylenol every 6 hours.
They said every 6.
Which is too often.
Which is too much.
OxyContin. We're not big fans of any type of drug like that. Not just because we're trying to keep the Sacklers from getting all their money, but because those are really not great drugs.
I don't like taking drugs. I don't
Yeah.
even like taking Tylenol.
Right.
I just
Yeah.
don't like taking anything like that. And the OxyContin, quite frankly, all it did was make my head loopy, but I still knew I had a knee replacement.
I would just want to say, if you are considering total knee replacement or know somebody who is, or just curious about it, this is where we get into here's what it's really like.
You've probably talked to people that have had knee replacement, and they'll say one of 3 or 4 things. Best thing I ever did. So glad I had it done. The first 2 weeks are the hardest.
Wish I'd had it done
Wish
sooner.
I'd had it done sooner. Wish I'd had this done 10 years ago. And maybe those things are true, but there's so much more to it that I believe there's a secret code amongst total knee replacement survivors that you don't talk about it. Don't tell anybody. Don't tell anybody what it's really like.
The first rule of Fight Club is you do not talk about Fight Club. The second rule of Fight Club is you do not talk about Fight Club.
Let them find out for themselves.
The first rule of the knee replacement club is we don't talk about what it's really like. We're going to talk about what it's really like.
And Cindy will cry because, first and foremost, this is the most emotional thing I've ever been through. And through my daughter, I found a total knee replacement recovery group on Facebook. And at first it terrified me because there are a lot of people that have really bad complications with total knee replacement. There are a lot of people that are months and months and even years out that are still in pain and wish they hadn't had it done. There are lots of people that have had a successful surgery and they're great. They're glad they had it done. But hands down, 99.9% of the people say this is the most brutal surgery and recovery there is. I've had back surgeries, I've had spinal fusions, I've had all these other things done, and this total knee replacement is the worst thing I've ever been through. And so especially that first couple of weeks, the emotions, it's an emotional roller coaster. I cried every single day, several times a day, and thought it was just me, but I found out through that group that no, it's everybody. Everybody just cries. I'm on day 30 and why am I crying now? But here I am. I am not to the phase of this yet where I'm glad I had it done. I am still in the regret phase. And that's a real thing, regretting it, just because I would much rather have the pain that I had to deal with and the not being able to take walks and stuff. I'd rather have that than what I'm doing now, even though I'm told this is going to get better and I'm told that this will go away and this will get better and I will be able to walk and do all the things I want to do and not have pain. So I'm hoping for that. But, you hear the first 2 weeks is the hardest. And then people say, well, after the first 2 weeks, the third week, you turn a corner. Well, then the third week came and went. And then I hear, by about week 4, things really start looking up. Well, I've gone past week 4 and then now I'm hearing, between week 4 and week 6, that's when the magic happens. So I'm really looking forward to the magic happening. I keep waiting for that. We had some problems with the pain pump that I came home from the surgery with. It had a tiny little catheter that went in my leg. And
let's talk about the coming home. What was there? The scar on her, they open up the front. Even though it's supposed to be, what do they call it? The
quadriceps sparing,
you still get the slit up and down the knee. You are cut from here to here.
It's just off a little tiny bit to the side of the kneecap.
They splay everything open on the table and then they come in from the side to do the work, which is the spare part. So you have stitches inside
that go down the joint this way.
There you go. I'm not going to show you my knee. Nobody needs to see that, but it comes down there. You still have that scar here. So these are dissolving stitches as you would expect the inside ones to be. This one it's not stitched. It's glued together. And then there's a bandage that comes across it. And what was that called?
So the first bandage was the zip line.
They put a zip line bandage on it. And then it's covered with the pico dressing that has a tube attached that you get to wear that sucks any moisture that may come out of that
up into the dressing.
Into a dressing. They gave her the little pain ball.
On cue ball
that looks like a magic 8 ball. You can shake it and say, will I ever not be in pain? And it says undecided. That is a catheter. I had this thing that all catheters had to be in your little one thing, but
This little catheter went into my knee, thank
A
goodness.
catheter is just a line that goes in your body, for those of you who are hicks like me. But it went in near where she had the incision and delivered pain slowly. And it was in a little ball.
Delivered pain slowly?
It did. This one did.
Deliver pain. It did
a
not
little
work.
ball that is supposed to, it has a pump that goes with it, but it's really full and it just slowly delivers pain relief into your leg until that ball is collapsed. And they're like, oh, you'll know when it's done because it's flat.
In about
it's
3 days.
Yeah.
3 days, it'll be all deflated, and it's just enough pain, really, just enough to help with, it's just an addition to the pain medicines that you're taking. It's not like numbing your knee or anything. It's just helpful. This thing was horrible, and it caused me so much pain and so much grief. And I had to carry it around in a bag over my shoulder, and then the tube going down, and then Saturday morning we realized that the gauze that's covering that where that is inserted is getting soaked in blood, like actively bleeding. We called the doctor on call, which happened to be my doctor, thank goodness. And that was when, he said, that's not really, it's not taking your pain away or anything. I'm like, no, it's not taking the pain away. It's making it worse. But he said, I don't know. I don't remember all that he said. What my takeaway was from speaking with him was he said days up to day 5, we call that survival mode.
Never heard that before.
Like, nobody told me that before.
So he did say that maybe blocked or something. You can undo the dressing and back it out a little bit. So we did that. And
that helped relieve it a little bit, the pain. Because the site where that little tiny catheter went in was just so sore to the touch. I mean, I couldn't touch my knee right there. It hurt so bad. And so then
the idea with this ball is after the few days, your home therapist person will come and take that out. You can't get that where we live. So it was going to be me or the PT folks. But I did back that out a little bit, and it seemed to start working only because we saw the balls start shrinking a little bit within a couple of days. Go ahead.
Yeah. Well, and so surgery was Friday, so I think it was Monday then. We went to PT on Monday. Did we take it out after PT?
Yeah. So
we took it out on Monday. Or no, we waited till Tuesday morning, I think.
Oh, that's right, because you called Kelly.
Yeah. And so I called the nurse and told her, but I think I called her after we took it out. I don't remember. It's all such a blur to me. But anyways, and she says, because I said this thing wasn't working. I said for at least the first 36 hours, it wasn't working. We called Dr. Copper. He said to back it out a little bit. We did that, and that now it's working a little bit. And I told her, I said, honestly, I would never have this again. If I had to do this over again, I would decline having that because that was miserable. And she says, well, it was working. It's just, it's only just for a little bit of help, blah, 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 and I said, well, we took it out because, it wasn't flat yet. Well, when did you take it out? Today? And it wasn't completely empty.
Yeah.
And I said, no, it wasn't empty. Oh, well, then that wasn't working. Oh, really?
You will get everybody telling you, oh yeah, that's normal, for things that are definitely not normal. And they will tell you later, well, that's not normal. More to come on those kinds of things. So, yeah.
But anyways, so it was a relief. But honestly, if I were to do this over again, which I would not, but if I were, if I knew then what I know now, I would decline that.
And I took that out. It didn't hurt coming out. But there was like that much of that catheter
coiled up,
going where?
Inside my knee, right on the joint area, so that as I'm doing my PT that I have to do several times a day and bending that knee, that wire was just in there, just digging me up, it felt like. So that was such a relief to have that out of there. Wow.
So yeah, that definitely wouldn't do that again if you were ever to do this again. So day 3 was the first PT appointment.
Yeah. The first outpatient PT. I'd already been doing the exercises that they gave me at the surgery center. But day 3, we went to PT and they had me do all the same exercises I'd been doing in prehab for the last 4 months. And I'm like, oh, same thing. Okay.
But it's like $400. Most of that to your insurance, but still.
Yeah.
An hour.
Yeah. And it's not like, I don't know what it's like at other PTs, but this is the PT for the small town that we live in. And it's not like you go in there and the physical therapist is working one-on-one with you and helping you and doing things. No, the teenage girl that works there comes over and she puts the strap on you, or, gives you, whatever you need to use to do, tells you what exercise to do, sets a timer for 3 minutes, although sometimes she forgets to set the timer. And then she leaves and you do the exercise. And then the timer goes off and she comes back and resets the timer and says, now do this exercise. And then she leaves.
And sometimes you say, I literally just did that exercise.
Yeah. And they're like, oh, you did that
well,
one
then
already?
let's see what's next
Oh,
for you.
okay.
And they go look at their chart to see what's next.
And then at the end, the physical therapist finally comes over and says, we're going to get you from 0 to 90 today. And so she presses down on my leg real hard to make it go straight. And then she puts a strap around my foot and has me hold that strap. And she puts one hand under my heel and one hand under my calf, and she lifts it up and goes, oh, and it's torture. It's torture.
Yeah, it was pretty brutal.
And I couldn't get up these 2 steps that we have in our house that I'd been doing okay on. I couldn't get up them after that. Dee had to help me up those 2 tiny little steps because I was just, it trashed me, that PT. And it took me 24 to 36 hours to like recover from that. Of course, meanwhile, I have to keep doing PT at home, my exercises, which are the exact same exercises I do there. Day 6, I go back to PT. Lather, rinse, repeat, all the same things again. This time it's a different physical therapist. And he says, well, you got to 90 on Monday? I bet we could do better than that. He has a little different method. He bends this leg up and puts his arm under it and holds on to this leg. And then he, while he's got his arm under there, then he just takes my foot and cranks it down and torture. I cried. I mean, I was just crying. It was horrible. It was horrible. And then the next day was my 1-week post-op appointment down in the valley.
So we're letting them do this because the day of surgery, as we're leaving, the doctor says, you need to be at a certain percentage, a certain angle when you come back in, or we'll bend it for you.
But he didn't say any angle. He just said, you need to get that knee bending, or I'll bend it for you.
And that is...
And I felt threatened.
Yeah. We'll put you under and bend that knee. We'll make sure that knee's going to bend. And it's so bad that we're going to have to put you to sleep to do it.
It's called manipulation under anesthesia, MUA. And it's not something you want to have done. So you want to make sure your knee is bending. So when I was doing what is he doing? When I was doing my PT exercises here at the house, I sat there and cried while I did them because it hurt so bad. But I was so afraid that I wouldn't have enough range of motion, when I saw the doctor again. And I didn't want to go through that. So
and through here, we'd not heard anybody say, at this point, you need to be bending it at this. We'd not heard these are the actual exercises, contradictory information.
Yeah, I had no
across
goals.
the board.
I didn't know what to be working toward. There were no goals given, I did finally find a total knee replacement orthopedic surgeon on YouTube that had started a channel during the pandemic. And he finally gave a timeline, and he said 90 degrees right after surgery, 100 degrees at 2 weeks, 110 at 4 weeks, 120 by 6 weeks. And he said, and you've got 6 weeks, you've got one chance. You've got to get this bending. And so I was like, well, I was 90 after surgery. They made sure of that. But then when I went in just last Thursday, the day before my 4 weeks, I was at 110. So I am on track, and which is good. And it just shows that I'm doing what I'm supposed to be doing at home, because after that appointment on day 6, well, then I went back on day 7, 8, 9, 10, 11, day 11. I don't know. And I had a meltdown, and I told them in there, I don't come in here for you to hurt me. You know that I will do my exercises. You know me. And I don't think that what you're doing is right. And I told my doctor, and my doctor at the post-op appointment said,
so this is the 1 week follow-up when we went in to see the doctor after the day 6, where they were just like,
where they bent
hey,
me to
look,
97.
we did better.
I told, it was the PA that we met with that day. Yeah. And I told her what they did at physical therapy. And she said, wow, that's aggressive. Be careful with PT. Those were her exact words. And that's, so I even said then, I said, nobody has given me any guidelines, any goals. I don't know what I'm supposed to be working for. I don't know where I'm supposed to have this at. She said, if my patients come in here at 4 weeks and they're at 90 degrees, we're happy. So anyhow, so then on my next PT appointment, I told them what the doctor said or what the PA said. And I told them that I was not going to come in here and be tortured like this. And so we basically, we didn't really quit PT, but we quit going twice a week. And now we go once every other week, basically for them to just check my progress.
Yeah.
They still put me through the little thing of exercises and, and they do the TENS unit, the electrical stimulation, which we bought one of those.
Yeah.
Is that what you were going to say?
So, well, we were going twice a week. I don't know how we settled on twice a week for rehab, prehab, but
that's just their
where
generic
we were. That
number.
Was, yeah.
That's what they do.
So we would go in. We found this out real quickly after the first couple of weeks. As mentioned before, they'd put her on, do this exercise, squeeze this ball, and set a timer for 3 minutes. They're gone. They come back. Okay, now lift this heel for 3 minutes, set a timer. They're gone. They come back. She's doing more than that at home for free. It's not about the money. Trust me, it's not about the money, but it's a little about the money when you're paying that much money to do less than what you're doing on your own.
Yeah.
So we were like, there's no need for us to come here and sit here for an hour to have probably maybe 5 or 10 minutes worth of attention the whole time.
Yeah.
Love the people there. They're super friendly. We're not getting our money's worth. It's not helping her to do that. And so we did go to every other week for therapy, and they were quite shocked that
and so that really, when I got home after we went to every other week, I really dove into YouTube, and because I felt like I want to make sure I'm doing everything I should be doing with that. But I did find a physical therapist that I wish I had found before surgery, because his whole career is all about helping people avoid physical therapy, or helping people avoid total knee replacement by doing physical therapy and working with muscle imbalances and things that cause all this pain, even when you're bone on bone. And he's got a ton of people that follow him that have literally canceled their surgery because they're living pain-free, bone on bone, because of the exercises and things, the protocol that he does. Anyways, I didn't find him in time, but I have him now. So, because I've already told this right knee, buckle up, buddy, because you're not doing that. We're not doing this. We won't do this again. I'm still in the regret phase. It's not, I don't regret it as bad as I did that first couple of weeks. I mean, that first couple of weeks, I couldn't believe I did this to myself. As time goes by, I'm getting a little bit away from that. I still have thoughts that I wish I hadn't done it, but more so now I'm just wishing it would get better, but it's a hard recovery. There are some people who are superhuman, but according to a knee surgeon, a surgeon that does total knee replacements, according to this surgeon, he says there are people, he has patients, says they're rare, but he'll have people come in at their 6-week post-op and they say they played golf yesterday. They've been doing everything they want to do. They were on the walker for a couple of days. They've been just going and going and going, and everything's great. And he says, I don't get it. I know what I did to their knee, and I don't know how they're doing this. He said, but some people are biologically set up to heal and recover faster. And I know a couple of them. Honestly, I have a neighbor up here that he had knee replacement, and he used the walker for a couple of days. The day after surgery, walked out and checked his mail, and I don't know how that's possible, but it is for some people. But I feel like my recovery is more typical. And according to this group that I'm on, this forum of other total knee replacement survivors, this is where most people are, and it's a long recovery. 12 months, some up to 16 to 18 months for total recovery. some people feel like they're total recovery by 8, 9 months, but then there are people on the other end that they're 9, 10, 11 months out and they're still in pain and they're still having problems. And I hope I'm not one of those. I pray that this does get better and I can be one of the ones that says, I'm glad I did it. I don't have any pain anymore. But it's really hard. It's really, really hard. So if you're thinking about doing it, do your research, learn everything you can, find that total knee replacement and recovery group on Facebook, know what you're getting into. I didn't know. I really did not have any idea that it was going to be this hard. When I had my rotator cuff repaired, that was tough. I still say I lost 3 months of my life in that recovery. That was a hard recovery. And I swore then this shoulder's just going to have to hurt because I'll never do that surgery again. This is so much worse. This is so much worse. And anyways, yeah, it's hard. It's really hard. And that's being truthful and being honest and being transparent. There are people out there that say, oh, yeah, I had my knee replaced. It was great. I don't think they're giving you the full story.
Let's talk about the equipment. We did talk about the pain 8-ball. We talked about the Pico that goes up your leg. Something they will start you with at the hospital. I'm going to unrecline myself here. Maybe go out of frame. But that's okay. Is this little Polar Care Cube that's supposed to do such wonders. Ice is magic when you've had this done. And this was supposed to be the answer to that. It's a machine, well, you fill this cube up with ice and then you top off with water. You plug it in, it pumps through this little snaky thing into this part that looks like a stingray, evidently.
It does look like a stingray.
And that delivers cold water onto your knee. I don't know how much they charged our insurance for this, but our insurance got ripped off. This thing is completely worthless.
Junk.
Junk.
And I know there are people out there that love it. They think it's awesome. Nope. It's stupid. I never felt my knee get cold and chilled and like it was being iced like it should. So
we bought a couple of the refreezable ice pack things off of Amazon that you can get like at CVS or wherever, but those did okay. But the magic came to us from a friend who lives here in our neighborhood, and it's in a homemade ice pack. This is one it's not frozen anymore. It's
slushy, but
slushy.
It's still cold.
It
doesn't have to be frozen to be cold.
So I have one here that's melted, and it's still cold.
It's still cold.
You may have seen me, if the camera's right, sit it by Greta. Greta loves the ice
Greta
packs.
loves laying on my ice pack.
She does. So this we have a seal-a-meal type thing that you can get the plastic sheets for the, I don't even know what you call it, sleeves, and seal them on the ends. You know how a seal-a-meal works. But you make your own in here, and this is just 1 cup. Let me stop rattling that so the sound's not there. It is 1 cup of 91% isopropyl alcohol and 3 cups of water. You put it in there. Don't try sucking the water out. Don't compress it down. Just put it in. Get as much. Don't try sucking the air out of it because you'll just mess up your machine as it all takes all the liquid up in there. Ask me how I know. But get the air, as much air out of it as you can. It doesn't matter. Seal it up. Throw it in the freezer. They freeze pretty quickly, but they don't freeze solid. And they stay slushy for a long time.
So you can form them to lay over your knees. So we typically always have one on the back of my knee because the back of my knee has been an extremely painful area. Yeah. And then one over the top on each side.
And we put a pillowcase on them because they will give you freezer burn. If you don't want these laying on your skin, you want them set up like that. So
normally this is inside of the pillowcase,
but it's outside for
display purposes,
demonstrative purposes. So that has been super handy. An ace bandage. Don't throw away the ace bandage that they give you because evidently that compression feels really nice. Right? and helps with the swelling. And we bought another one, used that a little bit. Speaking of compression, the hospital will also send you home with
Now,
the
some
squeezy things.
doctors send you home with what's called TED hose, compression hose,
Right.
and my doctor doesn't believe in those, so I didn't have to do hose. But I had to do these darn compression sleeves. Ugh.
One on each leg. They put
Hated
them
'em.
on right after surgery, and start with that. And they stay on for a couple of weeks.
Yeah, 2
You
weeks.
use these. You charge them up at night. Don't wear them at night. Don't wear them while you're walking the rest
Just
of the time. And
when
they
you're
just
laying
turn
down.
on and off. And they start
And then
squeezing.
they start doing their thing. Oh, it's so annoying. So annoying. I was so glad to be past that phase.
One on each leg. We're done with those. So she's pretty darn happy.
But hey, I didn't
about
get
that.
blood clots. But I also pumped my ankle all the time. I was constantly pumping my ankle. Ankle pumps for the win.
If you haven't noticed, I'll zoom out so you can see some of it. Cindy's leg is elevated. You want to keep that leg elevated and iced. It helps. We bought this, would you call it a cube?
Wedge.
A wedge on Amazon. We were a little worried the first day because the memory foam remembered that it was rolled up rather than decompressed. So we were worried about it the first day, but we'll put a link below where you can get this, because this has been wonderful. It's adjustable through the different pads you have on it. And lift your leg just a little. I want to show them.
Easy for you to say.
Right. Something that helped her at night is this one wedge that comes with it. She's, of course, don't have the wedge there while you're sleeping. You don't need the compression while you're sleeping. But lay your leg on this with your heel hanging off the edge, which has really kept her heel from...
I thought I was getting nerve damage in my heel because you have to lay on your back, your leg has to be straight, and your heel is just down into the mattress, and you can't roll over and change positions, and I can't get my heel off of the mattress, and the fire in my heel has just been tough.
We got the TENS unit that the physical therapist recommended. It costs...
It's drippy. It's drippy.
Oh, it's got some ice.
Oh, there's
on
ice
the
on it.
outside.
Oh, don't. Oh.
Handle ice scraping. Fingernails on a chalkboard. Look at me holding my knee like I've got sense.
Show off.
Right. I was going... Oh, TENS unit. The first visit to the physical therapist, they did a TENS unit. It's like a muscle stimulation. I know it's used sometimes for nerve damage. And in this, it just... Anyway.
It's supposed to help with pain.
Helps with pain. And so she was hooked up to that. I looked at the bill. It's $30 to have her hooked up to that for 15 minutes. It's not a lot of money, but you can buy one for $30.
And do it yourself at home.
Another reason we're like,
we do.
Why are we paying physical therapists to do what we can do at home?
Yeah.
So we have one at home. The worst part about that is the pads are cold.
Woo! It's like throwing a piece of dry ice on my leg every time you put those on.
So we do that at least once a day whenever we can. Other equipment is going to be a toilet seat riser. The granny toilet seat.
The granny toilet.
We got that pre-surgery because she was having a hard time with the knee, making the transition from standing to sitting and sitting to standing. So that's been there for
another
a while.
thing that's good for me to remember why I did this, because it's one of the things that I told that PA on that first visit was, I'm tired of having to hold on to my toilet seat to be able to sit down and stand up from the toilet.
Yeah. And now she has
I have handlebars.
handles. She has handlebars to help her do that. A shower seat. We should have bought that sooner.
Yeah, we just got that this week. Showers are tough, man.
So that it's been great having that though.
So great.
Necessary. And get the one that has the handles to push yourself up.
Yeah.
We'll put a link to the one we got because it's amazing. It's awesome. I didn't put this in the video that we completely shot that wasn't recording before. Don't have any
That
rugs.
was such a good video.
Right, it was. That was amazing. Don't have any loose rugs in your house. We have rugs here, but they're taped down.
Before
So,
surgery, I taped them
yeah,
all
they're
down
all taped down.
with
It's all
carpet
good.
tape, and so
They're
they're
never
good.
coming up. Because you don't want your walker to catch on them or to slip or fall. So
Yeah.
they send us home with a walker. It's a nice walker. It's lightweight. It folds up compact.
Her name is Karen.
Her name is Karen. Karen Walker.
Karen Walker.
Will and Grace reference. Oh, honey.
And I still use it.
She does.
Hey, honey, what's this? What's happening? What's going on?
We have a wicker basket that we have just run some Velcro straps. So when she's doing her walks and stuff, we put the basket on. It's not there.
That way, if I need to take something from the sofa
Right.
to the bed, I have a basket I can put it in.
We joke about getting a bicycle bell on there too with the basket on the handlebars.
But I am still using my walker.
We don't keep the basket on at night. One, because it doesn't fit our space. Two, because it does add weight to the front of the walker. And I'm hoping that there was a study done somewhere on should this balance. The downside to the walker is what it does to her hands.
Well, because I'm trying really hard not to anymore, but especially in the beginning, I would put so much weight, especially on my right hand, because it's my left leg, so the right hand is, helping that leg. Anyways, I'd get so sore in here. It's like this part of my hand was just bruised. It just hurt so bad, and it's still a little sore, but I try really hard. I'm still using the walker because I limp so bad without it. I can't not limp. And I don't know how much that has to do with the fact that I had my knee replaced or the fact that I limped for years before surgery. Yeah. And so my brain doesn't know how to walk without a limp right now. And I'm learning how to walk again, literally.
Back.
But with the walker, I have the confidence that I can try and practice putting weight on that leg. It's terrifying to put weight on that leg. It doesn't hurt when I do it. Once in a while it does. I have these spots on the inside, the inside edge, the medial area, I guess that's called, where sometimes, the weight, I'll get a little spot, but it really doesn't hurt. There's none of that bone on bone pain that I've known for so long, but there's the confidence issue. There's this fear of putting all my weight on this knee that I don't trust. I don't trust that this fake stuff that's in there is going to not buckle. It's not going to, that it's going to support me, that it's going to work correctly. And so with the walker, I have the confidence that I can try and practice, and the walker's there if I need it, but I can, and I literally have to say, left, put the weight on it. Right. Left, put the weight on it. Right. It's ridiculous. And I go very slow. I can get up the 2 steps with it. The one really good thing about the walker is the dogs can't jump on me because I have a cage around the front of me. Greta spends all of her time walking backwards in front of me, which is quite annoying. But anyway, so yeah, I still have my walker, and I hope to get rid of it soon. But I've seen enough things on YouTube from different physical therapists and doctors that say one of the mistakes that a lot of people make is they get rid of their assisted device too soon. And so keep it until you're confident. And I don't want to fall. I do not want to fall. So Karen is still my buddy.
Another piece is the bike. This is one thing they had at the gym that we didn't, so we bought a bike so she can.
Well, they had a big bike at the gym.
Right. But so we got the smaller one, which is the same thing as sit on a couch, run this, sit on a bike seat,
it's the
run
same
this.
thing, yeah.
It's the same thing.
And it's hard.
Yeah.
It's really hard.
So
it's like $40 on Amazon.
We'll throw a link down for that.
And it's just good. I mean, you've got to that knee has to keep moving. You got to keep that range of motion going. So don't jump on the knee.
I disturbed her because she was using that to keep cool. I had to move to pick stuff up. And I think the last one we're going to talk about is the grippy thing.
The grabber.
I would have one even if she didn't have surgery because it's just fun.
It's been fun. Took Jimmy a few minutes to get a while to get used to it and not bark at it,
But we bought it for Jimmy because he would bring her toys saying, throw this for me. And she's like, I literally cannot bend down to pick that up for you. Or she's on the couch like this and he's dropped it right over there. Well, now
I can reach down and grab a toy.
He's looking right now.
And I can throw the toy. And it's a game that Jimmy and I play. Sometimes I just go after Jimmy with it and really gets him riled up.
Oh, there you go. Good timing, Jim. So that's what we have found to be useful so far in the journey. We're not sure she'll go to a cane because maybe she's already started walking without the walker. Don't get me wrong, she's been doing that for a while, and
just
the
for
confidence,
like 10 feet.
Confidence is there. She's got this. So I'm gonna break from that and just talk to you. And when I say you, I want to talk to the people who will take care of the person who has had surgery. This is going to be the spouse, the friend, the mother, the father. Shouldn't be a mother or father for knee replacement. You have a huge part in this too. And it's a lot more work than what they tell you. I listened to her videos and I heard somebody say, after maybe 3 or 4 months, you'll be able to go back to work. I'm like, nobody said that up front, that she was going to be out of work for 3 or 4 months, but I get it. You couldn't go back to work on this when you're ready. But for the person given the care, there's a lot of work involved in that too. I took some time off up front because I knew the first few days were going to be... What you need, baby?
I just need to bend.
Okay. Because I knew that those first few days were going to be constant care because, well, she just, had her leg whacked in half and put back together. But nobody ever mentioned to me what my involvement in this was going to be. I'm not complaining at all.
He's been amazing.
I love this woman with all my heart. And I would do anything to make sure that she doesn't hurt. And the first few days that's pretty tough when all she does is hurt and there's literally no taking away the hurt. The oxy subdues that, but it's not just the physical pain. She talked about the emotional part and the self-doubt. Should I have done this? What the heck have I done? The second guessing. And as you get into it, there's also the emotional part, and just where she feels guilty for having to have somebody help her do the things that she's doing. She's very self-reliant. She does a lot for herself. She lets me take care of her, which is fortunate. But I think we've passed her comfort level of that. Fortunately, as I said, I do work from home. I've moved my office here in the house so that I'm not in the outbuilding where I was, in the barn or the office as we call it. And I'm able to be more attentive when she needs a bag of ice. She doesn't have to try and get up and get it herself, which she's doing more and more of. But I'm here to, make sure the dogs aren't jumping on her and take care of that kind of thing. So it takes a toll on everybody involved in this. So if you know someone who's going to do this, and you're going to be the primary caregiver for it, be aware of what's going on. If you have home health care, they're not going to be the primary caregiver, no matter what the doctor says. They're going to come in, they're going to check, they're going to make sure things are right. They're gone. And then it's up to you. So you can do it. Consider that whatever the emotional part might be, when you see them in their pain and whatever's involved in doing it, you don't have the pain yourself. And I would take this pain if I could and just let her recover if she can. But yeah, it's another part that nobody ever looked at me and said, do you know what you're getting into with her doing this? It's so much easier for me to see the light at the end of the tunnel. And I remind her that it was 2 years of her not being able to do anything that led up to this. And so a few months of not being able to do anything after is going to be worth it. And she just, wants to punch me in the throat sometimes when I say that. But
he's been an amazing cheerleader. And I couldn't have done this without him. There's no way. I don't know how people that live alone do this, because most of those people have someone come and stay with them for 4 or 5 days, and then they're on their own. And I mean, they do it. I don't know how, because I had to be alone this weekend for quite a while because he had to go to the valley for some
Well,
for some
I had to
secret
go to the
stuff.
valley for some upcoming RV stuff. That's pretty exciting. And
And
you
that
know,
was the only reason why I let him.
in the middle of all this, we finally had some movement on plans that we've been making and things we've been talking about. So I had to go Friday, which she was like, okay, I can do that. So I pre-made breakfast burritos. I pre-made sandwiches. I pre-made
Because Cindy can't take care of
cottage cheese and
herself.
applesauce and burritos for dinner, because I don't want her to have to. She needs to concentrate on this, not on how do I feed. But that's neither here nor there. So I went Friday, but then I had to be gone again all day Saturday, which was yesterday. And it was tough on her. It's tough on me, but it's going to be worth it. We're so excited. We can't wait to share that part of it with you. But that day is not today. So you just have to keep coming back and find out what that is. Anyway, back to the knee. I think we're wrapping up. We just
Sorry,
again,
this video is so long, but
we'll cut 5 minutes.
recovery is
out of it,
even longer. Okay.
We wanted you to get the story from someone who is going through it, not somebody who repairs them. I can't remember if I said this in this video or the last one.
I know.
Not somebody who does the surgery, not somebody who helps you recover, definitely not a physical therapist, and not someone who, well, and I say the physical therapist because some of the videos you find, it's a physical therapist who's saying these are the exercises you need to do. And they've never had knee replacement
Quit making that look so easy.
Bless you. Goodness.
Matter, Greta?
Oof. Got the sneezels real bad.
Happening?
But we wanted you to have this story from her having, not only having done it, but one, being far enough along that she can talk about it. And to catch you up to speed of what it's like from her point, from my point. We will come back with another one after we have the follow-up, the 6-week follow-up, to let you know how things are going. But we will get back to the RVing. We've just been a little bit busy. So we do have a couple of videos queued up. We've got this new exciting thing that required me to be away for 2 days that's coming up. You're going to love, and we're starting.
He wasn't gone overnight.
I wasn't. I was day trips. And we've already started making plans for some summer travels. So we're excited to share all that with you.
Fingers crossed I can.
Thank you for watching. If you hit that subscribe button, you'll know when our next videos come on. You'll know when to watch for the summer travel plans. It's going to be something completely different than anything we've ever done. Really, it's different than, I think, anything you've ever seen before. I can say it's going to be like a unicorn trip, right?
That's right.
Is that fair to say?
Unicorn.
So we're excited about that. Yep. Thanks for your support, guys. Like, subscribe, ring the bell.
Thanks for watching. And if you've had a total knee replacement, please, please, please let me know in the comments, what was your recovery like? And if your recovery was fast and easy, great. I am thrilled for you. Let me know. But if it wasn't, no matter what your recovery was, I would love to know what it was like for you. Where were you at 4 weeks? If you can remember, I don't know how long it's been since you had surgery, but and do you relate to any of the things that I'm going through? Because I know from this forum that I'm on that has hundreds and hundreds and thousands of people in it, that I'm not the only one going through this. So I would just love to hear what your recovery was like. If you're contemplating total knee replacement, don't let me change your mind. And, I hope I don't scare you. I hope I just encourage you to educate yourself, to prepare yourself, to ask your doctor all sorts of questions, to just really be prepared for this and be prepared for the long haul, because it's going to be a long haul.
Yeah.
So
yeah, it'll be fun to come back with the update after you have your 6 week, and
see if the magic has happened by then.
not only that, but to
Maybe the magic will
take
have
the
happened.
comments and we can kind of sum up and say, here's what most people
Oh.
go through. Or,
That'll be great.
you know, Jim Bob was water skiing the day after surgery, something like that. So yeah, let us know. I'm really curious to see how it has impacted your lives.
Yeah.
So I'm gonna go make dinner. You're gonna take a walk.
I'm gonna ambulate. I've iced and elevated. Now it's time to ambulate.
Give yourself a.
Then I need to do my PT again.
Not ambulance, ambulate.
Not amputate.
Ambulate.
Ambulate.
That's
Although there was a time I thought amputating would have just been easier than this.
T-shirt right there.
Yeah.
Don't amputate, ambulate. Anyway, thanks for hanging in there. You guys give yourselves a pat on the back for sticking it out, and we will see you in the next video.
Thanks for watching. Does it make my leg look this big since it's in the front?
Got a huge foot. I swear we say that in every video. It's all right.
It's fine. We'll be fine.
Unless things go horribly awry. But we do want to get back
Why would you say that?
I'll just cut that out. Erase.
Nothing's going to go horribly awry.
Nothing will. I want to do this without seeming like the typical YouTuber.
If you ask me a question, I swear I will just get up and leave.
So how's your knee replacement been?
Stop it.
I don't know. That's like a scene wipe
Okay.
as we're going through it. Jimmy gave up. We just got done recording and Jimmy is finally being quiet.
Finally, he says, I'm going to take a nap. He sat there and whined the entire video.
But
Gosh, Jimbo.